It is debt and very costly debt. So after 26 years, it's stories. It's stories which go on, and our story is a story of low-cost quality in eye care which continues. This is our multi-speciality which is coming up, and this is a slight diversification, but this is just because doctors, patients, and the staff at this stage want to do with the surplus. Thank you very much.
Thank you very much, Dr. Debashish, for a very insightful talk. Very few talks go to that depth. Before we move on to our next speaker, we have international delegates from the Republic of South Africa. I request them to stand, and we'd like to acknowledge their presence. Please stand in your seats. We have 3 doctors who come from South Africa, and Indian Ophthalmology is going to collaborate with them. Thank you. Next speaker.
So, next talk is by Dr. Satanshu Mathur, and he'll be talking about branding, why it is a must for all.
Good afternoon, everybody on the dais and the hall. I am starting from where Dr. Debashish has left, branding. On karna? Nahi ho raha. First of all, when doctors go for branding, everybody asks why doctors are going brand. Doctors are God. But even gods have started branding nowadays. We can see Tirupati Maharaj, Vaishno Devi, even Ayodhya now. They all have been branded now. So why can't we doctors be branded? Because this topic is not taught to us in the medical college. We have been taught our theory, how to do the hard work, but how to earn the money. What do after retirement? So these all things come in the branding. If you start doing branding only, you have heard all the speakers who have multiple chains. But how they make the chain? For that, you have to do the branding. Only then you can achieve the target of Debashish. So branding is very important, and a person who like me, who is working in a very small place, has branded himself. So branding is not a 3-tier, 2-tier city. Branding is in your mind concept. So why branding? This is the task. It is upon you which level you want to reach. I want to go to the highest level. If you want to go in the first or second step, sit in your place, do whatever you are doing, nothing to worry. But if you have to achieve the highest level, you have to do the branding. What business we are, what is a brand? Let's start by one. This Apollo tag is not a branding. You say, I fit a logo outside my hospital, this is branding. No, this is not the branding. A brand is not an identity. And finally, a brand is not a product. So what is branding? A brand is the total experience of a patient with your eye hospital clinic from the moment he enters inside till he leaves out. Means from the parking to the reception, to the optometrist, to the doctor, and finally he goes out. He should have a wonderful experience. That is the branding. Why we go to 5-star hotels? Because from the entrance gate, somebody comes and opens the gate, and then we are going inside reception, everybody talking well. That's why we spend so much money in 5-star hotel. So if you want patient to spend money in your hospital, you should have all the experience with the patient. Not only that doctor is good, nothing. Doctor is last part. First experience start, love start at first sight. So when patient enter in your hospital, cleanliness, hygiene, parking, reception area, this all make the patient happy when he come to you. Why should hospital brand? There are so many animals. Can you recognize any difference in animals? No. So like you, so many doctors sitting on the same plane. What is the difference between you and them? So many detergent powder lying there. You go and pick up anyone because there is no brand there. So gone are the days when patients used to loyal to the one family doctor. Do the patient has more choices? When somebody go to, let's say, search in the Kolkata or Delhi, he goes to the internet, type in center. So branding is there. He gets at least 5 to 10 answers. So branding is center is very important, attracting the patient to your center. Treatment nowadays shift to but commoditization. What is commoditization? There are so many balls, but red ball differentiates itself from others. Why? Because it has a brand. So if you want to differentiate yourself from your colleagues, you don't want to have competition from them, then you should have a brand. Otherwise, sitting there, working hard up to 60, 70 years, at last you will get nothing. A brand reduces the need to compete on price alone. You have to tag outside. Camp lag raha hai, aa jao, 500 rupees operation ho rahe, 2000 rupees operation ho rahe. Because you have brand that you do not go for all these things. These are all things done by the persons who do not have the brand identity in the area. So, a strong brand gives your employee also a focus. Not only for the patient. The three most important words in differentiating your brand is focus, focus, and focus. What do I mean by focus? You should focus on one specialty of your hospital. Suppose you are doing something which is not available outside. That is the focus. You consider on the LASIK, you consider Faberto, you consider on premium IOL. So you have to consider one part which is giving you more money, and you should publicize this thing more than other. Now I'll show you one thing. This is blue ocean strategy. How to create uncontested market space and make the competition irrelevant. You go for the thing. Suppose dry eye is not happening in nearby area. You start the dry eye clinics. You start the LASIK clinic. You start something diabetic clinics. So you are going to uncontested area. There is no competition there. And there is a red ocean where you are doing the routine cataract surgery. Everybody is doing it, and you are in the rolling around in the area. Arvind, take the example Arvind Hospital, take the Disha Hospital. What they are doing? They have started from the treatment for the poor patient. Now they are treating the rich patients also. So they have made their brand now. Himalayan drugs, they were the first to start the Ayurvedic medicines. And they have differentiated from others. So many allopathy medicines were there. They are no Ayurvedic medicine at that time. So this is the blue ocean theory. The birth of a brand is achieved with publicity, not the advertisement. Publicity, advertisement, those different things. Wow. Second important thing to make a brand is working with your own people. That he has said, Devashish, they are giving incentive. Yes, we have to make our staff our ambassadors. A person come to my hospital, he see 20 years, 30 years previously working here, got operated, his mother, father. Oh, still you are here. So he gets satisfied, this hospital must be good because staff are stayed there. Every time they come, new staff, that will give a good impression. We had to hire for attitude and train them for skill. We are doing opposite thing. We hire the skilled people. No, but if they do not have the attitude to work, they're useless. We should hire the person with attitude and then train them for the skill. They will be more loyal to you. This is the thing. You hire, recognize and reward them, and then communicate with them, train them, that make your brand. Henry Ford has said very rightly, you can take my factories, burn up my buildings, but give me my people, I will build the business right back again. So I can start so many chains if I have the royal person working with me. This is the thing. What most of us are doing, working morning 8 to night 8, हम 12 घंटे काम कर रहे हैं, rolling like inside the roller. No, you have to come out of it. How? By brand. So if you have brand, your schedule is filled with a lot of patients, but you do not seem to make a lot of money. You don't have the time for family, friends. You wake up early, every day exhausted because you are working rolling staff, because you're working on the same things everybody. No, brand means you should be free from all this nonsense. You work for 2 or 3 hours and money double then. I guarantee you, if you go for branding, your finance will be double in 3 years' time and you will be tension free. Spending too much time in the business rather you on the business. What does this mean? Cut off shine, so I'm running fast. A doctor, we do not know how a business is run exactly because we are not taught. We are good surgeon. We are good clinics. To run the practice of business, we need strong skills such as market analysis, competitor analysis, marketing, funding, digital marketing, everything we need nowadays. If you say we do not do it, then rest at home, better. Basically, all of us, what we are doing more. Most of us want to do more than the competitor. Say more patients, more surgery, more glasses, but time is restricted 8 to 10 hours. What we can do maximum 8 to 10 hours. But if you have brand, then within 8 to 10 hours, you can double your working capacity. I am sitting here, my hospital is running behind me. Why? Because I have a brand. I am sitting there, not doesn't matter. Most of your hospital must be closed because you are sitting here. So I am running very fast now. This is not to justify the branding which we do in years in 8 month times. So important thing is skill, pride, and technology. We can differentiate. Skill is everybody, not every doctor is equally skilled. Every doctor has reduced the price. Price is not important. Important is technology. Devashi has said, he has the optometrist in the hospitals. They are doing the retina examination on all the patients. So technology is very important. Skill सब में बराबर है, price सब कम कर सकते हैं, but technology जहाँ होगी, वहीं पर branding होगी. Providing unique customer experience with key. ये I just so. जब आप कॉफ़ी शॉप कॉफ़ी प्लांट लगता है वहाँ से 10 रुपये में हमें कॉफ़ी मिलती है, बाहर हम पैक करते हैं तो 25 से मिलती है, सर्विस करते हैं रेस्टोरेंट में छोटे में 50, बट वी गो टू कॉफ़ी बर्ग, व्हाट वी गेट इन 250, 200 rupees. So brand means you can sell the same thing at higher rates. There is no competition with others. I am doing the premium surgery costing more than my neighbors because I have a brand. This is the important. Work less and more. Okay. Then most important thing, just last minute, this is the doctor's view. Doctors think post-operative vision 6 by 6, patient happy. No. You can give 6 by 6 vision. Either patient will not be happy, staff is not good, hygiene is not good, bathrooms are not good. So what is, they should be happy on all the 4 counts. Initial 4 count, test, official visit, procedure day, post day. They should be make happy on all the 5 parameters. Only then they are happy. If 6 by 6 is happy, they will complete other things also. So brand means the patient enter from your hospital, go outside, come on the consultation visit. It should be 6 by 6. So to have a good website, Google ranking, digital marketing, you stop reading these books now. You are a mature doctor, you have learned everything now. Stop reading these books now. Too much time. What should you read? You should read how to get the money. Because all have had 12 or 15 years, spent a lot of money. For what? For moral duty? No. Now we have the time to earn the money. I have earned a lot of money for my children now. I am satisfied. Everybody should be satisfied now. So this is the branding. Thank you very much.
Thank
Talk, and I'm happy that my children had left the hall before you put that slide.